lactose-intolerant mother at William Beach Gardens, an issue that required constant advocacy. Commissioners will recall that Ms Ng told the Commission about how the extreme weight loss of her mother, the late Mrs Santoro, was not regularly monitored. You heard in earlier hearings about the importance of medication management and the poor outcomes that can result from inappropriate use of medications. Last week we heard from experts in this area. Dr Sluggett from Monash University outlined how multiple factors related to medication use could contribute to risks such as falls, urinary tract infections, weight loss, infectious disease, and could undermine sound diabetes management. Professor Westbrook from Macquarie University described a study undertaken by her team which identified that general practitioners may be making medication decisions on records with an average of 10 discrepancies per resident compared to the aged care facility record. Making medication decisions without accurate data could have serious consequences for a patient, she told us. The Royal Commission heard that aged care providers are at times not undertaking clinical assessments, not calling specialists when needed, or calling them too late. We heard that a CC Aged Care missed crucial assessments for the clinical care needs of Mrs Santoro. Like Mrs Alberts' case, Mrs Santoro's wound was not assessed until too late, and the right professionals were not made aware of the wound, and her weight loss was not communicated to relevant specialists nor to her family. Evidence presented last week indicated deficiencies in the clinical and personal care provided to Mrs Shirley Fowler. There was no referral to a physio for preventative exercise. Shirley's contractures were not identified by the provider's staff. It was Lyndall Fowler, herself a trained nurse, who finally identified the contractures, by which time it was too late. And these flaws were in a facility like those revealed at MyCare's Avondrust Lodge that had met 44 of the expected 44 outcomes across the accreditation standards. Many of the clinical experts involved in the hearing called for individualised assessments of older people across multiple clinical domains at the point of entry into care. And as Dr Batchelor of NARI explained yesterday, these assessments need to be ongoing and dynamic, particularly as people's conditions change. Dr Sluggett called for pharmacists to be involved when the ACAT assessment is undertaken, and Dr Osaskiewicz and Associate Professor Murray each emphasised the importance of continence assessments because the type of intervention is dependent on the type and cause of incontinence. Associate Professor Sussman and Ms Ryan of Wounds Australia noted in the Darwin hearing that good wound care starts with correct diagnosis and the use of appropriate wound management materials, and that misdiagnosis is a major problem. Both Dr Sluggett and Professor Westbrook called for the aged care sector to learn from hospital settings about patient safety, particularly in the use of medicines. Evidence before the Commission suggests that aged care providers are not regularly providing evidence-based clinical care. Reflecting on her vast experience in aged care, Dr Osaskiewicz was astounded at the lack of understanding of incontinence in the community and among health professionals. Wound expert Ms Ryan observed that evidence-based guidelines, although in existence, are often not currently adopted by providers. Dr Sluggett explained that data could be pulled together and linked from a range of sources in order to better understand and improve medication use and management, and Dr Batchelor yesterday made a similar point in relation to falls prevention. Concerningly, Commissioners, you've heard that deficient personal care is impacting on both clinical and quality of life outcomes. Ms Fowler believes that the most likely causes of the skin tear on her mother's leg was the inappropriate use of a sling and a failure to regularly trim her mother's toenails. Ms Backhouse described the lack of care her mother received after breaking her leg in her first residential aged care facility. She described finding her mother in pain, agitated, lying half out of bed and soaking in urine, while the care workers were, she told us, chatting in the nurse's office. Concerned about the level of care her mother was receiving, Ms Backhouse moved her to a different facility. Few of us will forget the still images from the surveillance camera Ms Backhouse installed in her mother's room at that second facility. On one occasion, her mother lay on the floor for over 45 minutes, and on another occasion she remained uncovered in bed on one of the coldest nights of the year. And Ms Backhouse described her feelings of overwhelming powerlessness to ensure basic humane care for her mother. She described this event as indicative of a much wider systemic issue, that of failure of staff to attend in a timely way following sensor or call button alerts, a phenomenon that we've heard a great deal of evidence about. She called for response times to be monitored by the Aged Care Quality and Safety Commission as part of a facilities accreditation process. Both Ms Fowler and Ms Backhouse identified systemic issues that undermine the delivery of quality personal care. They spoke of their observations of pressures on staff to undertake administrative or indirect tasks, reducing their ability to deliver personal care. The lack of access to sufficient aged care in the community is another systemic issue that warrants highlighting. As we've regularly heard these last 6 months, waiting lists in aged care are a critical factor in restricting access to the right care at the right time. Ms Fowler, Ms and Ms Backhouse talked about their experiences of no longer being able to care for their mothers at home. This led to them either taking leave or resigning from paid employment before eventually, and reluctantly, moving their mothers into residential aged care. Ms Alberts Henderson reflected on the joy of her mother being assessed for a level 4 home care package, but that joy being quickly replaced by sadness when told it would be at least a year before funding would come through. And Mrs Alberts moved into residential aged care 2 months after the assessment. Associate Professor Murray, a continence expert, noted that if we don't manage people in home and minimise their continence-related problems, they can become significant factors precipitating admission into residential care. We heard in Darwin about the impacts of long waiting times for community care, resulting in increased hospital admissions and entry into residential aged care. Professor Westbrook observed that the right type and quantity of community care may delay entry into residential aged care, and in particular, care that provides social participation supports delayed entry into residential care. Over the course of the hearing, we've seen in graphic detail the result of failures to prevent and manage wounds. Wound experts Ms Ryan and Associate Professor Sussman called for a greater emphasis on wound prevention. Early intervention could mean that simple and relatively inexpensive treatments prevent problems. Wound care consultant Ms Sharp also referred to the importance of the right equipment. She explained the value of alternating pressure air mattresses for those at risk of pressure injuries. The Dietitians Association of Australia have informed the Commission of the value of involving dietitians early to prevent malnutrition. Ms Maloney explained that a variety of allied health professionals can add a preventative and rehabilitative dimension to care. And Dr Batchelor spoke of the importance of focusing on the prevention of falls as well as the prevention of falls-related injury. Ms Ryan noted the impact of wound product suppliers in some aged care facilities and explained that in her experience some facilities restrict product selection because of the training provided by these suppliers. Over the last 8 days, numerous clinical experts have called for multidisciplinary teams in aged care, recognising that care involves